Hey there, this is Dr. Evan Osar. Do you work with clients that have shoulder impingement and or chronic shoulder tightness? Well, welcome to this edition of Integrative Movement Insider. Thanks for joining me in today's video. Happy Tuesday to you. Thank you for all you do for your community, and thank you for being part of our community. Lots of our clients have shoulder issues. They have limited shoulder flexion, overhead motion, as well as oftentimes they have limited shoulder internal rotation. Now, if you jump on the internet, and you likely have, like you are right now, you'll see lots and lots of shoulder exercises. Some of them are really good, some of them are not so great or not so appropriate for our clients. One of the things we teach as part of the Integrative Movement Specialist Certification Program, which is coming up here live in Chicago in just a few short weeks this fall, it's hard to believe, it's already almost September here, is we teach strategy. What's the difference between strategy and exercises? Too many people are chasing exercises, the next best exercise or the best or greatest exercise, and they're not looking at the client's strategy. Therefore, you're addressing or you're trying to address your client's issue, whether it be a shoulder issue in this video we're talking about, or low back pain, or tight hips. They're trying to use exercises to address a strategy issue, meaning how the nervous system is using the myofascial system and what the client's strategy is for using that particular area and how that area connects to the rest of the body. So, for example, you'll see lots of individuals, grab a band right here, doing these exercises like this, like external rotation, scapular retraction, and just exercises like pulling the band apart to work the scapular stabilizers. And that is a very exercise-specific approach to what they see. They see the forward shoulder, they see the internally rotated shoulder from this posture, and they assume that the client needs more strength back there. Sometimes that's true, but again, very few people are assessing, does your client actually need strength there, or is this just really compensation for a suboptimal posture and movement strategy, which it is. So when we look at our clients, number one, we're always assessing our clients, so we're going to teach you how to assess your clients. So it's just simple assessments like check shoulder range of motion, like shoulder flexion. How well do they flex their arm overhead? Do they have to compensate by overextending at the thoracolumbar junction? Do they compensate by throwing their pelvis forward for that lack of range of motion? Next, we're going to find out where our clients have a limited range of motion and or limited stability. I should say usually there's also a limitations in their stability or their ability to control that position or that movement. So once you do your myofascial release, because that determines where you do your myofascial release, well then we want to teach our clients how to stabilize, how to align and control. It's essentially what stability is. In our industry, we think stability is just what makes the thing most stable and doesn't allow it to move. That's not what stability is, or I should say that's a piece of what stability is. It's not all there is to stability. Your client has to learn how to move from that more stable place. One of the exercises we like to use, and again, remember, this is not just about the exercises, we like to use some kind of supported position. So hand supported on the wall, that's how we start most of our clients, because the hand and wrist feed up into the shoulder, and it's a closed chain exercise, meaning it's closed because the hand, the distal part of the kinetic chain here of the shoulder and upper arm is connected to a surface. So when we're first training our clients, we're going to do something with the hand in contact with a surface like the wall. I'm going to use the ball here in a moment, and or the floor. Next, we want to teach our clients not only how to stabilize the shoulder into the more optimal position. For most of our clients with that forward shoulder position, it's really about getting that upward rotation and posterior tilt, which is this motion right here. That's the most challenging thing for our clients, because once our clients have this motion, or I should say this position, and are able to control it, everything else becomes really easy. Then it's just adding load to that. However, getting your client's strategy for aligning and controlling that scapula in upward rotation and posterior tilt, that's the challenge. So once you've done your myofascial release, now you want to teach your clients how to stabilize it. So I'm going to use the ball here. Stability ball works great because it's wide. It's usually about as wide as a person, maybe a little bit wider as it is in my case. It allows me to grab the ball. It allows me to keep the wrist neutral. It allows me to maintain the scapula in upward rotation and posterior tilt relative to the thorax. So from here, as I'm grabbing the ball, I'm going to just hold the ball there. I can just push it lightly into the wall. So I'm doing a bit of scap protraction because again, what we're doing with scapular retraction is really just teaching the client how to stabilize the arm once it gets out here in front of the body. Retraction doesn't teach the body how to, the person, the individual, how to control the arm once it's out in front of the body, and that's mostly everyday life. So you may need to train retraction, but you have to teach your clients how to protract and control protraction, because that's everyday life. So this is a great exercise to teach your client how to protract, maintain upward rotation and posterior tilt. However, you also need to teach your client how to move from there. So from here, with the hands in this position, I can now breathe in, breathe out, and do a hinge position. So now I'm teaching the client how to create stability with the scapula on the thorax, and then I'm also teaching them how to get mobility at the ball and socket or that glenohumeral joint. So they're going to breathe in as they come up, breathe out as they hinge. And again, you can see if I drop this ball basically here, that starts to train my overhead motion. So again, it's not about your exercise. Is your exercise actually changing, or most importantly, improving, creating a more optimal strategy for your client? An more optimal strategy where they can align better, control better, and integrate that motion into a functional movement, which that is, because that's training overhead motion. And then you want to incorporate that into and integrate that into your fundamental pushing and pulling patterns. And again, as I mentioned, hopefully you see that it's not about your exercise, it's about what is your exercise specifically doing for your client, and most importantly, is it helping to optimize their strategy of alignment and control, and of course, integrating breathing into that. So is the exercise better helping your client better align, better breathe, better control? And that's how you know you have the right exercise or right group of exercises, and that's how you know you're starting to change your client's strategy. You've done your pre-assessment, and then you just check your post-assessment to see if their range of motion has improved, because that's ultimately what you're trying to do. Have you improved their range of motion, and more importantly, have you changed their control? And that's how you change your client's posture and movement strategy, help them optimize it to the best of their ability, and move closer and more successfully towards achieving their health and fitness goals. And that's how you become that go-to specialist for your current clients. And as I mentioned, we've got a live training coming up this fall in Chicago, Illinois. We're going to teach the foundations, the fundamentals of the hip, the shoulder, and the core, and show you how these areas integrate, so that way you leave with strategies that you can immediately implement into the programs that you're already using with success. I'll put the link next to this video wherever you're watching it. Click on it for more information to see if this program is right for you and the clients that you work with. We guarantee that you will leave with strategies you can use right away. We guarantee that this is some of the best information that you have learned on the hip, the shoulder, and the core, and how to integrate this information. And like I said, you don't need to change everything you're doing. You can incorporate this information into all those programs that you're already using with success. So click on the link. If you have any questions, put your questions below this video. Next to this video, I will answer them as well. And we look forward to seeing you at the live training, because that's the best way to learn and integrate and understand this information, because when you get to do it in your body, there's going to be tons of hands-on live training. We're keeping it to a really small group because that's all our studio can handle. However, it will also give you lots of hands-on time, opportunity to ask your questions, and like I said, leave with information you can use right away with your everyday clients. So this is Dr. Evan Osar with Integrative Movement Insider. Thanks so much for joining me. Again, questions, put them below this video, and we look forward to seeing you in Chicago this fall. Make it a great day, and keep doing what you're doing. Be that leader for your current clients, and be that leader that incorporates everyone, who helps everyone achieve their best, and be that leader that your potential clients are looking for. Make it a great day, and we'll see you soon here at Integrative Movement Insider. Take care.